Hey Doc, I am back with another amazing guest. And I know I say that for all of my guests, but they are really amazing. And this one is no different. She is a dear friend, a mentor, and reading your bio, I just have to say I love the financial liberation strategist. I love that. But she is also a urologist and a mom, just like you, Dr. Felecia Froe. Welcome, welcome,
Hey,
welcome.
hey, Latoya, it's good to see you again.
I am so excited to be here with you and to hear more about your journey long before we ever met, when your kids were now quite, I don't want to say old,
Advanced.
advanced. Advanced was a few word that was in my mind, but I was like, I don't know if that's a good word either. But yes, tell our listeners how many kids you have and how old they are.
I have to say how old they are. This doesn't have anything to do with my age. My children. I have two daughters, and one of the things I think about is like I don't understand how they're getting older, but I'm not.
Right.
My youngest one, this is hard to say. My youngest one just turned 30. My oldest is 32. Will be 33 in December.
Yes. And Dr. Felicia is only 29. I don't know how that happened.
I'm gonna say I'm 40.
Yeah, who knows? It's a medical marvel. Okay, so take us all the way back to when you had the first baby. First of all, what stage of your career were you in?
I was in residency. I was in my first year of urology residency. So urology has 2 years of general surgery, then you go into urology, and urology residency at that time was 4 years. So I was in my first year. No, that's not true. I got married in my first year of urology residency. I had my
Yeah.
child in my second year of urology residency, maybe third. Q more than
So,
1991, bottom line.
so is it that you did the 2 years of general surgery and then like the actual urology part is what you're talking about?
Correct, correct.
Gotcha.
Yeah. I got married in my third year, and then we had a baby the next year. Yeah.
Gotcha. Okay, so I just want to take a little bit of a segue. What was it like being in a predominantly male specialty at that time? Like, what was the environment for a woman?
Well, I was very lucky, number one, because I had in my department at the University of Missouri Columbia, there was a woman attending. She wasn't married, she didn't have kids. So it was a little, there was some different, but she was very woman focused, and she wasn't gonna let anybody really take advantage of you and treat you in a way. And I have to say the guys in the group, whether it was related to her or not, they were very the attendings were it was very family oriented. We are a family, we get along, we take care of each other. I really, really liked our program. I really did.
Oh, wow. Is that why you chose it?
I didn't know anything about it like that before I got in there. I got very lucky because I mean I hear about all these other people with these horrible, toxic relationships in their residencies, and we didn't have that. I didn't have that at all. So I was very, very lucky.
Oh, good. Great. So you got married. Was it your plan to have kids so soon? Did you want to have a residency baby?
I did well, it wasn't about residency. It's like I was 30 already. It's like it's time to get this done. If we're gonna get it done, let's start. So what I wanted to do, we got pregnant actually fairly quickly. My first pregnancy was a miscarriage, which was
Mm,
really hard. Got depressed, all the things that go with now you're thinking now it seems like really, but yeah, that was hard because I really wanted to have a baby.
mm,
Got pregnant again shortly thereafter, and I mean, I did worry about it in residency. I had a lot of pain during pregnancy, like
mm,
pubic bone pain. You're trying to walk and get stuff done, and you know, at that point, I felt like I wasn't. And maybe it was on. I was putting it on myself. I felt like I wasn't keeping up. You know how you could before I mean, maybe everybody else didn't have this, but before pregnancy, I could run around and keep up and do all
right.
the things, and now it's like I got to walk a little bit slower to get the things the further along. So
Right.
it took a while for anybody to notice I was pregnant, and so finally
Mm,
I just kinda had to tell them, and then I mean, it was okay. I'll
yeah.
tell you, I could talk about the things that I worried about as we got along, but it was okay.
It was okay. Well, that's not great. So we're definitely going to talk about that. But if you don't mind, I want to go back and talk about your miscarriage. I've heard from a lot of people that they've had really traumatic experiences with their miscarriages, not from the miscarriage itself, but from the work environment. And I know you said your program was very family friendly, but that's a whole different scenario. What was the experience in that situation?
Honestly, I have to now think about it. We have been talking a little bit, and I actually forgot about that, and so we started
Mhm.
talking today. The things I remember right off the top of the bat was, number 1, I didn't miscarry naturally, air quote,
Mm,
naturally, so I had to have a DNC to actually
mm.
finish off it. It was like I started having pain. It was over Christmas, I think, too.
Oh,
So it seemed like I was on vacation.
yeah.
It was like I wasn't at work, and I had to call, and I was like, "Maybe it's a UTI. Should I do this?" All these things were going through my mind, and then I got back, and she did an ultrasound, and so she goes, "There's no heartbeat." This was in the first trimester. Um, and okay, so now what do we do? Well, you can wait, or we can do the DNC. So that mentally was a big thing for me, because I still in my mind's like, "Okay, but maybe you're wrong. Maybe there really is a heartbeat." And you're like, "Did I look at the ultrasound?" Yes, I looked at the ultrasound. Did I see that little flicker light? No, I didn't see that little flicker thing. But I still had a hard time. And I think it was a few weeks before I actually admitted that, "Okay, there's nothing here. We gotta go ahead and do this." Because it did it. It was that baby, that thing was not coming out of me on its own. I
Yeah.
had to go do something about it.
Yeah, and I know this is not what this podcast is for, but I still am an educator at heart, and it's something that I had to learn the hard way, thankfully in residency, about how we as OBGYNs manage and interact with women who have had missed abortions, which is what you had, like a
Mhm.
missed miscarriage,
Uh-huh.
meaning, you know, we look, no heartbeat, and what do we do now? Because coming up in residency, at least in my time, there was this level of callousness that we were trained to have that was really quite dangerous for our patients. And it's just like, well, I mean, this is not a big deal. But one of my chiefs had to tell me, she's like, no, this is a very big deal. Even though the quote unquote baby is a fetus, but it's a baby to that woman,
Yeah.
right? And she was the one who said, no matter how many times they want to come back for another ultrasound, do it. Because it doesn't matter that you know that there's no heartbeat or that there's no chance. It matters to her. And it just reminded me when you were describing your experience, it is very, very common.
Yeah.
And since then, any amount of time, I'm like, you want to come back for us to check again? Sure. No problem.
She forgot about that, and it's really getting me now.
Yeah.
It was hard. It was really hard. And then I remember laying around for quite a while, and I had to go to work, but I don't even remember that time, except I remember being very depressed and sad.
Yeah. How did you get through it?
I don't know. Time
Yeah.
happened, and then, okay, you can start trying again. So it was at 6 weeks of nothing, and then, okay. And I remember my doctor, who was actually also a friend, said, "Usually, after we have to do a DNC, pregnancy comes fairly quickly."
Yeah.
And I was like, "Okay, well, let me know when I gotta go." And so it was like 6 weeks went by. It wasn't much longer than that, and I was ready to try again, and I really
Mm.
did. I got pregnant fairly quickly. But
Yeah.
then, you still have this, and if anybody's had a miscarriage, there's still that fear that, "Okay, this could happen again. I don't Is this one gonna go? Is this gonna be good?" And I don't know how long that lasted, but it did go. Everything
Yeah.
went well.
Everything went well. Okay. I know it was a long time ago and I'm really jogging your memory, but do you remember it being like a significant amount of anxiety that was affecting like your daily life or that you had to suppress because you were at work or it was just, not too bad?
I'm gonna say I don't remember, but I'm pretty
Okay.
sure I was suppressing. I'm pretty
Yeah.
sure, because I can remember that after she was born, how much I suppressed. So I'm pretty
Yeah.
sure in that time I was suppressing. It was like, you just got to go to work. You can't let anybody
Mm.
know. You don't talk about this kind of stuff. And I had all the people in the residency were guys, but I was actually friends with their wives.
Mm.
So I had them to talk to also. So there was some, I didn't feel so alone. Does that make
Yeah.
sense? Even though
Yeah.
I wasn't in practice, and the woman attending had never had kids, so she couldn't experience this.
Right.
There were actually other women attendings and the wives of my colleagues who, again, which made it easier because we were a family to talk to about that kind of stuff.
I'm glad that you felt comfortable because I feel like it's very easy to say, well, I don't want anybody to see me like that, and think I'm less than or anything like that.
Yeah. And I probably had that too. I probably
Yeah.
did. And maybe it was easier that I could talk to the women, people not in the program, because they
Right.
didn't see me that way anyway. They see me as Felicia, and yeah,
Right.
you work with my husband, but like you're
Yeah.
Felicia.
Okay. So was your birth particularly eventful or was it just like, Okay, everything went well.
No, it was eventful. First, so in addition to the pain of the pregnancy, pregnancies were hard for me. Deliveries
Yeah.
hard, but I thought the pregnancy was harder just because it went long,
Yeah.
like so long. And then towards the end, I ended up with high blood pressure, proteinuria, and then the doctor was like, "You got to go in the hospital." I'm like, "Really?
Right.
Can't I just go home and rest?" No,
You're
no,
going.
you're going in. So I went in, and then that night they started a cervical something, prostaglandin cervicus,
Hmm.
soften things up, and then the Pitocin started the next morning. I remember, oh my God, they're coming to turn it up again. They're turning it again.
Oh, were you not getting an epidural and I got
An
into?
epidural.
Oh, okay.
Right. I had my anesthesiologist lined up. Everything was
Right.
lined up. It was just that, you know, I didn't, my first time, second time was a little different. I'll tell you about that too. But the first time was like, I don't know. Can I ask for it now? Should I get it now?
Yeah.
Like, this is some stuff right here. He came up, put it in, and it didn't take all the pain away. I remember my sister getting her epidural, and she just laid there through contractions. You could watch the contractions on the monitor. She didn't move. She eating, doing.
Yeah.
I didn't have that.
Yeah.
It was just like take the edge off. And she was born probably from the time it started at 7. She was born before noon, so she was born in
Mhm.
that. Yeah, it went pretty quick.
Yeah.
Um, so that was the trauma, and I remember that my doctor said she came back in, 2 things 2 funny thing. She co as the baby's coming out, she goes, "Do you want a mirror to see?" I'm like, "No, just ki."
I love offering that. Something I want to see. Ask almost every time, and I'm always entertained by the reaction. Because a lot of people say no, and it's just like, well, why would you ask me that?
"No, I don't wanna see anything." It was almost like, "If anybody has to leave this room, I no. Everybody stay right here, get this baby out of me." That's how I was feeling.
That is hilarious. All right. But she was born and she was healthy. Everything was fine.
No, she had a heart murmur. I mean, after a
Mm,
time, of course, yes, she ultimately was healthy, but she had a heart murmur, so we're having this scary part, and they said, I'm in the hospital and we're in the regular post labor and delivery place. And they come in, they check her out, and it's like, well, if in the morning she's not in the nursery, she'll be in the NICU. And I'm like, wait a minute, hold on a second. What? If you take my baby to NICU, you need to come and tell me right then,
right.
not tell me in the morning. She did fine. We went to the
Yeah.
cardiologist afterwards. She had a patent ductus. And,
Mhm.
they made us go to a cardiologist who then they had to say, "Well, this cardiologist, he's a really good cardiologist, pediatric cardiologist, but he doesn't have a very good bedside manner." I'm like, "Oh, for God's sakes."
Ah, the kind of things people get away with.
Fortunately, they did her echo, and it's like, "This thing is closing as we speak." She did fine, and I didn't have to deal with him more than that one visit. I think maybe there was 2. Maybe she did come back and make sure it was closed, but there was nothing else after that.
Okay. Mm,
Um,
good.
yeah. But before that, I had been on bed rest for 6 weeks. So
Oh,
before she was born, I had to be on bed rest for 6 weeks, which is where the stress started
right.
coming. I remember what happened. I was going on to this rotation with this resident that I didn't like. I thought he was incompetent. I'm gonna have to work hard. I'm like, this is gonna be terrible. I remember walking around the mall and starting to have contractions. And I don't know how many weeks I was, but evidently not enough to be having contractions until
Right.
baby. So I got put on bed rest. So then I started worrying. It's like, okay, God, what am I going to do? They're going to shut me down. They're going to kick me out of the residency. They're going to. Fortunately, one of the guys had torn his ACL skiing shortly before that. Like he was back at work, but he had to be off work for 6 weeks. So
Mhm.
in my mind, it's like if they start giving me a hard time about having to
Right.
be off, then we're going right to that point.
Right.
Well, the guy, he tore his ACL. He did, yes, I got pregnant on purpose. He tore his ACL doing something on purpose. We got it. But it never was a thing. It never was
Okay.
what he
I
said.
love that you had your plan.
They had a plan. 'Cause yeah, I just had no idea what was going to happen. Then she was born. And then, then comes, I was going to keep wanting to say post-op, but then comes the
Postpartum.
postpartum part. Yes. Which
Tell me
was,
about that.
I don't I wouldn't have said I had postpartum depression, but I had postpartum anxiety. It's like you're going home with this baby. I remember driving home thinking, "What are they going to send me home with this?"
Isn't it funny? It's just like, so y'all really like this is all
And I've got to figure out what to do once I get home.
right.
I very much remember that. Getting home, I nursed her. We, drove in the back. I sat in the back seat with the baby, driving. My husband driving 20 miles an hour to get home, which was fortunately like only 3 blocks away from the hospital.
So wait, there was no car seat involved?
No, we had a car seat.
Oh,
Front
okay,
in
okay.
the car seat. Yeah, all the things. Of course, we had all the things, and still driving 20 miles an hour. With me sitting in the back, making sure nothing's going to happen to her. Anyway, we get home. The nursing was hard. Was really hard, and it's just like that's an experience. It's just like, and it was my milk came in, but it just was very sore. Every time she latched on, it was a toe curling. You want to scream kind of pain. And people are like, "Well, it's just natural. It's natural." I'm like, "Why? Does it hurt so much?"
I'm gonna tell you, that was one of the worst experiences, especially the second time around. It was excruciating every single time for months.
Yeah. It was bad. Fortunately, somebody told me, "Take the tea bags." Like, "What kind of tea bags? Is there
Mm.
something special here?" "No, just regular tea bags. Get them wet, put them on your nipples before you nurse, after whatever, just put them on there, and it'll help." And it did. It really
Interesting.
did. I was like, I was ready to do anything. I don't care. So
So were they warm or just like cold?
it was I don't even remember. I didn't soak them in hot water. I just,
Yeah,
like, ran them under the faucet and put them on there, and I
gotcha.
don't know if it was the tea that numbed it felt like a little numb. It just was a little numbness, and next time she latched on, I was like, "Oh, that wasn't as bad as the time before. Let me walk around with tea bags in my nipples."
All the things we do. So how long did you last breastfeeding?
For her, 6 weeks, maybe a little longer,
Mm.
because I had to go I went back to work at 6 weeks.
Ah, okay. So pumping at work was not an option.
I don't even think I thought about it.
Gotcha.
I don't even think I thought about it. I remember going back and after first case coming out with, I had the breast pads on, but that didn't hold anything. My
Yeah,
shirt's all wet. Unfortunately, the nurses are in the room. They're like, "Okay, yeah, here, we got this. Go change your clothes."
oh my gosh. So how was it going back after 6 weeks? First of all, your husband is a physician, right? No, he's not. Okay.
No.
But was he home?
No, I can't remember. I can't remember. But his mom lived in town, so she
Ah,
was watching her after she was born. And that was still hard. That was really a hard time for me. And it was probably another 6 weeks, maybe 3 months after I went back before I decided I wasn't going to quit.
wow.
And interestingly, it was the day I decided I wasn't going to quit that the chief resident came up to me and was telling me how my work, he didn't put it this way. This is my words. He was much more professional about the conversation. "Your work sucks. You got to get better. I'm running around looking after you, making sure." And that's not, and I said, "I know. I've just
Mhm.
decided I'm not going to leave."
Wow. So tell me a little bit more about what was going on. Like what made it so hard in particular?
I felt I always wanted to be an involved mom
Mm.
and going to work. I mean, so clearly remember, like, I don't even know what my daughter does all day. I don't know. Did she pee good? Did she poop today? Did she eat well? I just didn't know. I get to see cute pictures sometimes, and then I come home and I'm tired. You come home, you go to sleep. It's like, I don't, I don't know if I can do this. I got to figure out what I'm going to do. I very, very much remember thinking of quitting, very much, but not
Wow.
knowing what I was going to do, which
Right.
kind of has led me to where I am today with my stuff I do because I want nobody in that position.
Right. So what made you stay? Like what made you change your mind?
I don't know. I don't know. I think it might as much as I don't know what else I can do. I was in that frame of mind. I've got to, pay off these loans. Put all this time in. I don't know what else to do. I really don't remember. It was almost like a switch that said, "Okay, you can do it. You're going to stay."
Wow. What was your ex-husband's what was he saying, feeling during this
I
time?
don't even know if I was having the conversations with him about it.
Wow. That's
I don't even know if I was. I believe I was talking to him about feeling like I wasn't a part of her life. Like, I don't
mm,
even know what's going on, but I don't know I don't remember feeling like he felt it. Does that make
hmm,
sense? And I'm looking back on that, of course,
right.
after a lot more marriage.
Gotcha. Okay.
And the same thing with the miscarriage, thinking about that is like he didn't feel that sadness and all that. It was almost like, well, I don't understand. What's the
Mm,
problem? And then I could get to, it's like, okay, well, you never felt it of being inside of you. You didn't have all
mm,
the same kind of feeling about it. I can tell you another funny story. Get to a funny story now. Right when we were before delivery, I think I was on bed rest already, and we were in the kitchen talking, and I was talking about the epidural and blah blah blah. And he says, "Why don't we try to do it without an epidural?"
Why don't we try?
I said, okay, why don't every time I have a contraction, I squeeze your testicles and we see how long we last?
What was the response?
He said, okay, I understand. Like, yeah, there's no we in this conversation and
Right,
pain.
right. That is hilarious. Oh boy. All right. Any dads listening out there, don't say stuff like that.
Or in the middle of labor, looking at the monitor and going, that doesn't look like it hurts.
He said,
That was another thing he said. Here, that one doesn't look like it hurts. Like, are you freaking kidding me?
looking at the monitor, not at you.
Not at me.
Got it.
Like, yeah,
Got it. Got it. Okay. All right. How did you get along with his mom?
good. But I didn't know how to be a mom. I didn't know what I'm supposed to, what can I push her on? What can I
Yeah.
say I need? What can I didn't do any of that stuff. It was like, she's doing me a favor, taking care of
Mm,
my baby while I'm working.
gotcha. So do you remember at least the feeling of, I don't like this, but she's doing me a favor?
Yes.
And is it that you didn't feel empowered to say something because you didn't know that you could? Or what was the reason?
I think it was I didn't know I could. I don't even know that I knew what to ask for.
Yeah.
That was the other thing. It's like, so yes, your baby's pooped or something, she's doing, yeah, she would always say, she's doing great. She's fine. And then later I would think about the specifics of the thing. But
Yeah.
how much does she eat? Did she do, all the things? And that seemed like every other mother in the world knew these kind of
Mhm.
things, which
Yeah. Not true.
now I know. But that's what it felt like, that everybody else knows how much, what everything their baby's doing, they know. And I know I'm take my baby over here, or my husband Ian takes her over there, and then we pick her up, and I come home and I try to spend time with her and I'm dead tired, and it was not good. It
Yeah.
was really hard. It was really hard.
Yeah. It sounds hard and it sounds familiar. Very, very familiar. So that was fourth year. How was the
Fourth and
rest?
yeah, fourth and
Fourth
the
and the
fifth,
fifth.
yes. And the rest went fine. I remember I went to the retirement party of one of my attendings recently, and he told a story of me bringing Takara as my daughter to poker night and sitting her on the table, poker table, and she went to the bathroom.
Oh
And
my.
he said, all I said was, don't let the cards get wet.
And these fellas a fond memory.
I mean, it really was family.
Yeah.
It was good. It was good.
That's really nice to hear,
Yeah.
especially at the time. Not that it was that long ago because
It,
you're not that old, but
well, it could have been. I mean, there's
yeah.
lots of women in urology, a lot of urologists who did not have that kind of experience and would not have even thought to get pregnant during their residency, because they're not going to be accepted. They're going to all the
Yeah.
things are going to happen that you think can happen. They're going to happen because guys don't have to deal with that. Just so you know, all those things happened to me in practice. A lot of those things. In my
Mm,
first year of practice, I got pregnant again, and then it was nothing like residency. Residency was
wow.
hard having it. It was harder in practice.
Well, tell me about that. So you come out. How old is Takara at this point?
Takara, I finished in 93. Takara was 2,
Okay.
a little over 2. And then I got pregnant again. It's time, let's get this other one born. And with her, they were doing maternal serum alpha fetoproteins at that time. That came back
Oh.
abnormal. So then we had to have a amniocentesis. And then there was a whole conversation with Ian around that. If it comes back abnormal, there was a lot of stress around that thing. What are we going to, and I'm like, the only reason I'm doing this test, this is what I said to him, the only reason I'm doing this test is so that if she needs something, I didn't know it was a she at that time, but
Yeah.
if this baby needs something when it's born, I want everybody in the room.
Right.
And it was my thought process on it. His thought process was a little different. We would let this one go and have another one.
Mm,
And I was like, yeah, no, we're not doing that. I'm not
yeah.
doing this. I want the room taken care of.
Right. Did you know that you all diverged on that particular like value in terms of, if the genetics is abnormal, let's terminate versus no?
That was the first conversation
Mm.
when we decided to do it. It was before it was done, but he said his feelings about it, I said mine, and then we did it. Fortunately, we didn't have to deal with that because
Yeah.
everything was fine. But I could have seen that being a big issue, because I was like,
Yeah.
"Nope, I'm having this baby."
Yeah. And I was recently on a podcast where I was talking to residents, and she asked me about the different things people should talk about before they get even married.
Uh-huh.
And I was like, there's so much stuff.
Yeah.
And this is like, so for any resident listening, this is one of those things where you would never think to talk about it.
No.
But it is a huge thing about, what are you going to do if it comes to potentially having a disabled child and all of the ranges of disabilities that they can be.
Mhm.
And what are your beliefs? Like, what are you going to do? It's something that you should definitely know beforehand.
Yeah. And you might not know, but at least you have the conversation so that
Yeah.
y like, I don't know what I'm gonna do. It kind of
Right.
depends on the things, but I it is a it was that was very stressful, and it was
Yeah.
I knew I was not aborting. I just knew.
Right.
And so it really didn't matter. It was like,
Right.
you can think what you want. This isn't happening.
Right. And that's what I was about to say. It could be a deal breaker. And the way that you answered that, it sounds like it would have been a deal breaker, at
Yep.
least like in practice, in your heart, all of that. So
Yeah.
it's really important to talk about all of these things.
Yes. And that is not something that you would think to talk about
No.
because who thinks that's gonna happen? You don't.
Yeah.
Anyway, she was fine, and let's see what happened. Oh, in practice, that practice, so that one, I came in replacing a woman. It was like
Hmm.
12 guys. And again, painful pregnancy, had to be on bed rest.
Hmm.
And they were like, why do you need to be on bed rest? My doctor had to write, I'd had a conization,
Mhm.
cervical cone. So I had this kind of flat cervix, and then
Yeah.
gonna, so they wanted me laying down.
Yeah.
And so my doctor had to tell them information that was none of their damn business
Right. Right. Right.
for me to be able to be on bed rest. And then when I was like, and then she said something about 6 weeks off after. So again, I only took 6 weeks off. And they
Even
were
as an
like, "Why-"
attending.
as an attending, yes. And I said, why do you need 6 weeks off?
Wow.
It was that relationship was fairly hostile. I think I
Wow.
stayed there 5 years. And I keep saying it was just because of the weather. I was in Minnesota, but there was a lot more to that.
Yeah, that sounds like it's definitely more than the weather.
Yeah.
So you did another 6 weeks. How was that on not just your mental health, but like your physical body going back to work 6 weeks now twice?
I don't remember physically having a lot of problems. I did pump with the second one.
Okay.
So we breastfed for almost a year with her. I don't remember physically having a lot of problems. I had to be separated from her because that was time for oral board. So I had to go down and
Mm.
do oral board. So I'm pumping down there thinking she's not gonna want me when I get back. And my husband's going, yeah, she will something because they kind of go at your arm when they're in your I tell you,
Right, right, right.
see, but it ain't me.
So what was the difference in the decision to pump? You just were more educated about it?
I was gonna do it the way, yeah, I guess so. I think so.
Oh.
Maybe I thought I couldn't in I don't even remember thinking about it in residency. I really
Yeah.
don't. And then as maybe somebody talked to me about it. I don't really remember. It was just more of a, and my mom, my mother didn't even participate in that conversation because she didn't nurse us. We were bottle
Yeah.
fed. And so that was not even something she really thought about or could advise me on. I
Yeah.
remember her telling me I need to sterilize the bottles and do I was like, sterilize the bottles? Got me a bottle sterilizer. I'm like, Mom, I don't think we need to do that anymore, but okay.
Well, people are still doing it now. So, yeah, we stopped. We had like these sterilizing bags and stuff. Probably did it like once. But yeah, they're still selling
Oh,
sterilizers and there's a whole bunch of stuff about, you don't need to versus you need to. And yeah,
no, we didn't sterilize. We also didn't feed the babies. We didn't feed any of them like baby food in a jar.
yeah,
We ate ground up
yeah,
when they start
yeah, yeah.
eating, right? Which is why I think my kids have kind of sophisticated palates now. Like,
Right.
how is this bland food? Let's give us some food. We want real stuff.
That's great. Very great. So, besides the work environment, what do you think was the most difficult part of them being that young? Because it would have been two under three, right? Two kids under three.
Yeah, Takara was almost 3. Reed was
Okay.
born in October. Takara turned 3 in December.
Yeah. What was the hardest part of that situation?
When Reed was born, I recall that Ian was working. Interesting, funny, interesting story. I get home from the hospital with her, and like, there's no food in the house. He drops me off and goes to work. And I'm like, there's no food. Takara's needs to eat. So here I
Right.
am, newborn baby, first day home from the hospital, going to the grocery store.
So pause. Where was his mother at this point? Who was helping you?
We moved.
Oh,
We
I
moved and
see.
lived in a different city at this point.
Okay,
Yeah.
so no help.
Now that being said, I probably could have called my neighbor down the street who took Takara while we went to the hospital. I just didn't even think about it. Maybe she was at work. Maybe I don't remember.
Yeah.
Why I didn't even think about doing that. Again, one of these I got to take care of it myself moments
Right.
without thinking about who can help you, which is I'm so much better now to think about. Now I think about who can help me,
Yeah.
not I got to take care of it. And how can I do this myself? And it took a those are the years that have passed in my life that needed to pass for me to get to that point. So, we do grow up.
It could take a while, but it does happen.
Yes.
So, okay, so this is like one of my things though, right? So, what was the thinking surrounding not having somebody there consistently that you will plan were at not even only paying your mom, somebody else, or having like a nanny or something like that?
Yeah, there was no thought of that. None. My mother came, and I recall her not being of any help. She's just like there to and maybe I'm remembering it wrong. I just remember doing the laundry. I remember like she was there to hold the baby when I had to go do something else that she didn't want to do or that kind of that's what I remember. And nobody around me taught every mom that I knew, and I didn't know doctor moms,
Mm,
were nope, they didn't have nannies and stuff like that. That didn't come along until like one of my good friends, the one that Takara went to her house when I went to have Bree, got a nanny much later, much later. Like we weren't even living in the same state anymore. And her kids were all actually in school by that time, but she
mm,
got a nanny. Two of her kids were in school, one was still not in school. And she got a nanny then to help. But it wasn't something that was still at the time when women
yeah.
did everything. You don't you just take care of it, figure it out.
Even doctor moms.
You yes. I don't even think I knew doctor moms.
Mm,
So I'm in this urology practice by myself. One of the neighbors down the street was a family practice, but I don't think she hadn't had any kids at that point.
mhm,
And in my circle, not even in the town, but out, people from residency and that kind of thing, I don't think I was talking to anybody. It was
yeah.
seemed like this is a thing you just do, which at this point now I would never, it's like, no, you don't have to. You
Yeah.
don't have to do all that by yourself. So what happened is he was working at the time, sometime down the road, and then before Takara went into kindergarten, I'm like, she was probably 4, maybe it was halfway through Reed's first year, that I was like, this is ridiculous. We never see each other.
Mm,
We are, like, the kids are in daycare, which is icky. They're eating stuff I don't want them to eat. This is just bad. And you don't make enough money to make it worth it.
mhm,
That was honestly a thing, but I don't think I said, hopefully I didn't say it that way. But it was like, why don't you stay home
yeah.
and take care of the kids and let me make the money and do the work and
Yeah.
you take care of the house, which he did. He agreed to. He did.
He agreed willingly, or was that like a thing?
You know what? I don't remember it being a thing.
Okay.
I remember him agreeing to that pretty easily. The problem came up is that it's not like you would think it's going to be. It's like I think if I was staying at home, my job is to take care of the house. That's my
Right.
thing. And he took care of the kids. The kids were good. Nothing bad happened to my kids. They had on clothes that I wouldn't have had them in, but they got to be creative. Like, I go, what does she got on? That's what she wanted to wear. I'm like, she's fine. But it would be like just as a family thing. No dinner was ready. There's no
Mhm,
dinner cooking. It's like, what do you want to have for dinner? I'm like, I don't freaking want to make another decision
right.
today. I don't care what we eat. So that became a big thing. So that was, bigger than just the kids, but I'm thinking the person that stays at home is the one who takes care of home and makes decisions what we're going to eat and
Yeah.
all those kinds of things. And that I was still making a lot of those kind of decisions, even going to
Mm.
work.
So what was the conversation surrounding that, or was there no conversation?
When we finally had the conversation, it was like, well, you don't usually like what I fix. It was like, okay.
Sounds like a cop out.
Yeah.
And I'll say that only because you all are no longer married. I would have had respect for your husband if you were still married.
No. Yeah, there was, I was talking to a friend of mine this morning who as a guy, who recently divorced, and now you're looking back at your life and you're like, yeah, this lasted way longer than it should have when you look
Mm,
back at all the things you put up with and tried to
yeah.
fix. And I was married for 19 years. 19.
Wow.
But we stayed married a very long time. Um, and now some of these things I didn't even remember. Now we're talking about 'em like,
Yeah.
I forgot about that. Yeah. And I can just tell people now, I was like, why did you get divorced? Because I felt like I was doing everything and finally
Mm.
became enough. If I'm going to do everything, I'll just do
D-
everything.
yeah.
And now when I look back at what everything is, I'm like, oh yeah, I was
It was a lot.
everything
For how old were your kids when you all got divorced?
in high school.
Mhm.
Takara was a senior and Reed was probably in eighth or ninth grade. So they
Oh,
were
wow. You really held off for a long time.
a long time. And I actually just, stayed married because I didn't want my kids to be a statistic from a broken home and da da da. I wanted them to see what a mother father household looked like. And the day I decided that was done was a day this Takara said to me, like I had to go to work and Ian was working at that time. And I said, so tomorrow I have to go to work early. I have surgery. Do you want to go to school early or do you want your dad to take you? What do you want to happen? She goes, well, dad's always tired in the morning. And I think maybe I can't even remember what she said. Just her saying that was a trigger for me. I said,
Yeah.
okay, honey, I need to tell you something.
Mm.
I'm gonna talk about your dad. Are you okay with that? Yes. Okay. I'm just gonna tell you what I did in the last 3 days. And I talked about how on that Sunday I had gotten up at 3 o'clock in the morning, gone and done a case, came home, made your breakfast, made your lunch, went back to work, picked you up from school, blah, 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 all these things. And dad went to work and came home and he was working a night job and slept all day and then went to work. And she goes like, oh,
Wow.
just what I said wasn't as bad as she thought it was going to be about her dad. And it was that moment that I thought, oh my gosh, what she's getting from me staying here is that the woman does everything.
Right.
That was when I was like, okay, this is over. This is done.
Yeah.
It is and the reason I say that is I think we often stay in situations for reasons in our heads that aren't the reasons that somebody else is perceiving. For example,
Yeah.
you stay in a marriage because you want your kids to have a dad or a mom. Either way, it just doesn't work out. They're not getting what you think they're getting out of it. Is what I'm trying to say.
Yeah. I think that's a really important lesson to share. And thank you for sharing it because I see so many people say, the marriage is over, but we're going to stay married for the kids. I'm like, those kids don't need you to stay married.
You know,
They
they
need,
need you to be your parents. They
exactly.
need parents.
Yeah. So what was their reaction to the divorce? Were they completely surprised? Or
That's funny too. So we had decided, okay, this is happening. Or I decided I wasn't doing anything else to make it come back. So
right,
we'd done counseling, we'd done all this stuff. And so it was like, okay, we got to tell them. And he was hesitant to tell them. He was actually in the kitchen making dinner that night. And I told the girls, they come in the living room, girls, they needed to have a conversation. So they come in, they're sitting there and they go, what? Okay, senior in high school. And so they were like, what? What do you want? I was like, we're going to wait for your dad. And he took forever, took forever, took forever. They said, you guys, you're scaring us.
Mhm.
He finally came out and said, we're getting divorced. I said, oh, can we eat now?
So what was your reaction? Like,
I was like, oh, okay. So this isn't going to be a traumatic. I still
right,
worried about it. I still thought about it, but it's like, oh, okay. It really went to, can we eat now? There was no more conversation about it.
yeah,
And maybe it was that they were so scared we were going to tell them somebody was dying.
right,
That
right,
hearing it's
right.
just the divorce is okay, fine. Okay,
Yeah.
cool.
I mean, and you've had a lot of your child's life since then. Have y'all talked about it and were they secretly traumatized or were they expecting it?
I don't know that they were expecting it, but we haven't actually really talked about the
Mm,
divorce a lot. We've talked about my relationship with their dad, and we've talked about those kinds of things. They had a doctor appointment, regular checkup kind of thing, and I told the doctor, "It's like this is what's happening." And at that age, I didn't go in the room with them. They got to
mm.
go talk and do what they had to say. But she knew that, and when she called me later, she goes, "Yeah, I got nothing. You guys are doing a good job." Like, okay, good.
Good.
And we tried. There was no. We never really had arguments or fights. It just seemed
Yeah.
like this is done. Let's get this divided up. And no, we didn't even do lawyers or anything. It was just like
Oh, wow.
let's call this a day. And
Oh, well,
Move on.
that's nice. Do you think that if you had said certain things at the beginning when the kids were younger, it may not have ended up that way in the later on?
I think we would have gotten divorced.
Okay.
I think we would have still gotten divorced. Um, it was a long time. So even basic things like having a housekeeper, having somebody come clean was a conversation. And to me, that's like, that's a set that. That
Yeah.
you go to work every day. You don't need to spend your weekends cleaning. So and I remember having that conversation with a physician, a woman physician, and she was struggling with that. And
Yeah.
she was, her kids, she had kids already, and she was really struggling with, I should be doing that myself. I should be taking,
Yeah.
no, you're just as good a mom and woman. Somebody else can do that. And think, and you have to, we even have to talk when women are having a hard time with that to say, you're giving someone else a job. You're giving someone else
100%.
something to do. It's not you're not doing it. You 100% could do it, but give somebody else a job that wouldn't have a job any other way. Sometimes that gives them the permission to do it. And just to not have to clean a toilet, my gosh, come on. You can
My
afford
God.
not to clean the toilet.
And I think that's an important point because I told that to somebody recently because it can get to a place where it seems very elitist very quickly
Mm.
because we are naturally high earners and all of these things and the social status, whatever, of being a doctor is that, I think I'm too good. And that is not the case at all. We know that you can do anything. You are a woman physician. You can do whatever you want to do. But should you be? Do you have to?
That's
And you could empower another woman to take care of her family, or it could be a man too, I suppose, but you can give somebody else a job.
and if you really look at your own life, there's how many other things would you rather be doing? When it
Right.
comes to business, you think about what is my highest and best use? And your highest and best use as a woman physician is not cleaning your house on the weekend. You want to spend time with your kids. You want to spend time with your husband, your spouse, your partner, whoever that is, and you want to do good work. Take care of patients. It's not cleaning the house is so far down on the list. Take it off the list. Give that to somebody else to do and feel good about it. That is, of all the things to do, to me, that's the easiest one. Right. Cross that off. You can clean my house, take care of it. And will they do it perfectly? Of course not. Of course
Right.
not. But it's gonna be good enough.
It's going to be done.
My toilet gets cleaned. And it was not getting cleaned on a regular basis when it was up to me.
That's the thing. That's the thing. It's either you're doing it all and you're stressed and burnt out, or you're not.
And angry, stressed, burnt out,
Right.
angry, all the things. We didn't do nannies, and I don't know. I just never thought about that. I never thought about
Mm.
that. I'm trying to think, what would I advise my daughter today? She was thinking about going to veterinary school, and her spouse works as a nurse. It's like, yeah, you probably want to have somebody because, I mean, I'm probably not going to be the one.
Why? Grandma?
Grandma's going to live in a different country.
See, grandma's living her best life.
But you should have somebody in there, and I put some cameras in your house, do all that kind of stuff,
Right.
and you'll be okay. Yeah, it does seem radical, it does. Even when I'm saying it, it seems like, "Oh, it's a lot." It is a lot to think about, and actually, one of my friends where I used to work had a baby, and she has an immune deficiency disorder.
Mm.
Not the baby, the mom.
I was about to say which one. Okay.
Mom. And when her child, like, she stayed off for 3 months, then she went back to work, came back to work, and the baby went to daycare, and the baby started getting daycare stuff
Mm.
and come back, and then mom is sick for a month. And it happened like 2 or 3 times. I said, you gotta get a
Right.
nanny. You gotta get somebody coming in your house. This is not working." And she struggled with it too. But
Wow.
she finally, because she kept getting so sick, decided that was the right thing to do. And once she did that, and it took a while. It wasn't the first person, but it took a while. And again, they got a great lady coming in, and then mom stopped getting sick.
Yeah.
The daughter, I keep wanting to call their names, which I have no permission to do,
Right.
did fine. They're
Yeah.
still friends. Her daughter's now 10. They're still friends with that person. And it's just
Yeah.
like, it was just such a, for that reason, if you're getting sick,
Yeah.
just let it go.
Yeah.
Maybe.
I think that is like an extreme example, but it is an example of the kind of sacrifice is like, how much are you going to give? She was literally giving her health
Yes.
because of this idea of I can't have somebody else raising my child, and also she was in daycare anyway.
Yeah.
You might as well. It's not like if you were home with her, which
Exactly.
again, no judgment. My daughter's in daycare right this second, but it's just like give yourself a break.
Yes. And why, and we do think about, I think it is that elitist kind of we think, well, we can't, like, that's just rich people do that.
Right, right. And then that brings in the money conversation, right? Like, what are your money issues? It's another conversation you should have with your partner. What are your perceptions about money? What are your perceptions about what makes a good mom? Because all of that is going to affect you and how you mother and the choices that you make.
Yes. I think we both know somebody who wanted to get a housekeeper in and their husband said, no, why do we need that? And like, after they had their baby and they're like, yeah, I'm
Yeah,
not going to do it.
right.
It's like
And neither are you.
being a traditional wife, mother. Well, I think we could argue what traditional means, but if we talk about that June Cleaver traditional,
Right,
mom stays home, takes care of the kid, that's gone. We don't, you already left that part when you decided to
right.
become a doctor. Now you can't go back. You're not
Yeah.
going to go back. And we want to have them both. We do. I get it. You want to be that great mom, June Cleaver mom, taking care of everything, and a great doctor, doing your surgeries, taking care of your patients. And then you are the one that suffers. And that's not
Yep.
the right place to be.
Yeah.
It's hard.
It's hard. And I want to say a couple of things as we wind down. Number one, you are dating yourself by the June Cleaver reference. But it's okay.
So, but it's June Cleaver. Leave it to
That's
Beaver.
I think so. I don't even remember. That may be a factor of I did not grow up in this country because
I
I
didn't watch
did
it.
what?
I didn't
Yeah.
watch it. It's on like game show. It's on some network.
Game Show Network. That is also dating yourself. Game Show Network. So that was the one thing I wanted to say. So, but for you specifically, you mentioned traditional. You had some fairly traditional ideas about motherhood.
Mhm.
Where did that come from for you?
That's a great question. Because my mom was not a stay-at-home mom. We went to daycare. Mom
Right.
had a job. I think it was I just wanted to do it different and better than my mom. Because you can look back and see all the problems you had
Yeah.
in your childhood and how
Of
you could
course.
do it better. I think that was where that came from. And
Yeah.
maybe if I stayed home, maybe if I was home and I didn't do all, whatever. Well, I
Yeah.
don't even remember what was in my head now because it's not there anymore.
Right.
But
Right.
it's like way washed out. Like, what kind of craziness was that?
It's so amazing how you look back and you really like, yeah, she did this and he did that and I could do it so much better. And it's just like you have no idea. You have no clue.
The day you come to the realization that your parents were doing the best they could, yes, you might be messed up, but your parents were doing the best they could. It's on you to fix it. I had this conversation with my nephew recently. Your mother did the best she could do. It's on you now. You're 27 years
Yeah.
old. Go to therapy. Talk about us. We don't care. It's up to you.
And that's something else I think is really important before we become mothers. Like, figure out your shit that you've been taken from childhood before you then have another child and then make your whole motherhood experience about either being just like your mom or being
So
exactly
different from
opposite.
your mom. Yeah.
Yeah.
That's a hard one though, because do we realize the stuff we got from our childhood before you have your kids? Because your
I
kids
don't know.
reflect some stuff back on you. And
Right.
things like, "Ooh, I sound just like my mother. Let me go to therapy."
Well, at least be open to even realizing that is a possibility. And that is the purpose of this podcast is to get the wisdom from people like you and to have these conversations so people can think about it and realize because somebody listening may not even realize that that's what's happening. And because of this, they're like, oh, wait a minute. Wait a hot second.
Growing up, it's the kids growing up is something else. Raising your
Yeah.
kids. I remember my
Yeah.
kids were getting fat because mom would feed them dinner before dinner.
Wow.
And then when I asked her to stop, that was a thing. Oh my gosh.
Oh my
Ooh.
gosh. You see, that's what, even though I'm a huge proponent of free help and pulling on your family and all that, sometimes paid help is better than free help. Let me tell you.
Because you can tell them, you can have
Yeah.
some rules. Yep.
Yeah. All right, Felicia, this was amazing. And thank you so much for sharing all of your stories and going way back in the archives.
Way back. Way back. Thank you for giving me a chance to remember all those things. Because
Yeah.
thinking about my kids, I look at pictures of them now when they were that age, and all their ages, all the stages were good to me. It was all fun. Yes, there were
Yeah.
challenges along the way, but it was all fun. And I think they're amazing women now and doing great things in the world. And I don't think I would change any of it.
Oh, that's beautiful. With that said, let people know where they can find you if they want to learn more about everything that you're doing, about your podcasts, all of it.
Okay. So my podcast is Money with Mission. My company is Money with Mission. And we believe that every woman should have the financial ability to walk away from any job or relationship that's not in her best interest. That being said, my really thing is I want everyone to have options financially. So just like I talked about, I had to stay in this job when I really wanted to quit. I had to keep doing, you just have to keep doing because you financially don't have money coming from anywhere else. So I help women get passive income or income coming from other places, not having to put more work in. So moneywithmission.com is the website. Money with Mission is the podcast on Spotify, Apple, all the places. And we just talk about being better with our money. Another thing that we don't talk about very much, money, to get it out there.
Yes. Yes, I love that. Thank you so much again. And Doc, I will see you on the next episode of Stethoscopes and Strollers. Bye.